Hello, I'm Bill Coos with the Blanchard Valley Health System, and this is a special edition of COVID MythBusters. There's a lot of information out in our community about vaccines and about COVID. Some of it's factual, some of it's just not really true. So, what we've done is we've assembled a group of experienced BVHS healthcare providers to bust those myths.
Myth: I've been vaccinated, so I don't need to wear a mask.
So, as the Delta variant continues to spread rapidly through the US, the CDC's mask guidelines have actually changed because despite the vaccination that you could receive, the Delta variant has been proven to be highly transmissible. And with the transmissibility of the Delta variant, even vaccinated people can have enough viral load or virus in the system to be able to spread it. So the CDC now recommends people wear masks inside public spaces in areas where the spread of the virus is substantial or high, regardless of your vaccination status. So myth: I'm not at risk for severe complications of COVID-19, so I don't need the vaccine.
So regardless of your risk for getting a severe infection, you absolutely should get the vaccination, not just for the benefit of yourself, but also for the benefit of your friends, your family, your children, your greater community at large. If you get the vaccine and you do happen to get COVID-19, it'll prevent you from having a severe infection, severe response that may wind you up in the intensive care unit or, God forbid, worse. Myth: if you already had COVID-19, you do not need the vaccine.
Fact: due to the severe health risk associated with COVID-19 and the fact that reinfection with COVID-19 is possible, people are advised to get the vaccine, even if they've been sick with COVID before. One thing to keep in mind is the development of multiple different strains of COVID-19, especially the Delta variant, that has been proven to be more transmissible and cause potentially worsening and severe COVID pneumonias in this sort of situation. Experts don't know how long someone is protected from COVID-19 after being sick, and the immunity someone gains after having an infection, called natural immunity, varies from person to person. So some evidence suggests that natural immunity may not last very long. Myth: certain blood types have less severe COVID-19 infections, so getting a vaccine isn't necessary.
That's unfortunately not true. So the research has shown that there's no reason to believe that a certain blood type will protect you against developing a severe infection or protect you against contracting COVID at all. So again, the value of getting vaccinated is tremendous, not just for yourself, but also for the entire community at large and your close friends and family and loved ones.
Myth: natural immunity is healthier and more effective than vaccine immunity.
Vaccines allow you to build immunity without the damaging effects that vaccine-preventable diseases can have. These diseases can cause serious health problems and can even be life-threatening. Even with advances in healthcare, the diseases vaccines prevent can still be very serious. Vaccination is the best way to prevent serious health complications from this disease. Myth: COVID-19 vaccines will give you COVID-19.
Fact: none of the available COVID-19 vaccines or COVID vaccines currently in development in the US contain the live virus. You cannot become sick with COVID-19 from getting the COVID-19 vaccine. Myth: receiving the mRNA vaccine will alter your DNA.
Fact: mRNA stands for messenger ribonucleic acid and can most easily be described as instructions for how to make a protein or even just a piece of a protein. mRNA is not able to alter or modify a person's genetic makeup or DNA. Instead, COVID-19 vaccines that use mRNA work with the body's natural defense system to safely develop protection or immunity to disease. Myth: the COVID-19 vaccine causes really bad side effects and allergic reactions.
Fact: the vaccine can cause mild side effects like other vaccines. The most common side effects are fatigue, headache, pain or redness at the injection site, muscle or joint pain. Side effects like these, although unpleasant, are all signs that your body is working to protect itself from the virus that causes COVID-19. People who've had bad allergic reactions to the ingredients of this vaccine or other vaccines should talk to their healthcare provider because most people can tolerate the vaccine.
So, one of the myths out there is that pregnant women cannot take the vaccine.
False. On the contrary, in fact, the American College of OBGYN, as well as the Society of Maternal-Fetal Medicine, and even the CDC now, all recommend the COVID vaccine be given to patients that are pregnant. The American College of OBGYN and the Society of Maternal-Fetal Medicine, from the start, felt that's important that pregnant patients be vaccinated because they saw that patients that are pregnant have 5 times increased risk for complications, such as patients being on the ventilator, patients requiring ECMO. That's actually where they put a patient on bypass until the lungs could actually provide the patient with oxygen, and even death. So if you ask them, is there a particular time in pregnancy? They say anytime you could get it. Before pregnancy, during pregnancy, immediately after pregnancy. If you could get the vaccine, it's in the best interest in the patient. Again, the benefits far outweigh the risk.
There's a myth that the vaccine will affect my fertility and I shouldn't get it if I plan to become pregnant.
That's false. Again, there's a lot of misinformation out on the internet. As far as the vaccine, there's no reason or any scientific evidence that it would cause decrease in your fertility now or in the future. Some of this misinformation was spread from people who have spread other misinformation. The problem with the internet is that it's a source of medical information. Not all of it is peer-reviewed. Anybody could write anything about any topic, publish it, and if they have a site that has a lot of followers, it could quickly spread viral. So the original claim was that the mRNA codes for the spike protein that we talked about before, which looks similar to the syncytin 1 protein, which is responsible for attaching the placenta to the uterus. This is completely false. They're not even related. So as far as fertility now or in the future, there's no evidence to show that it will decrease your fertility. In fact, the CDC has tracked this. People that have gotten vaccinated and compared that against people who were not vaccinated, and the conception rates were pretty close or the same. So, false.
There's a myth that being vaccinated or coming into contact with someone who is vaccinated with the COVID-19 vaccine will affect my menstrual cycle.
False. There's no reason why it should affect your menstrual cycle. As far as menstrual cycles go, they're very complicated, as everybody knows. It's a very close balance between hormones that are produced from your brain and your ovaries, timing. So there's a lot of things that affect your menstrual cycle. It could be stress, it could be infection, could be medications, could be even a change in weight. So it's not uncommon that a person that's struggling with decisions as far as safety for themselves, their families, their parents, that it could affect your menstrual cycle, but it has nothing to do with the vaccine. So false.
Myth: the COVID-19 vaccine was developed from fetal tissue.
Again, false. Again, another rumor. But the fact is that the COVID vaccine was not made with the use of fetal tissues, and it does not require fetal cell cultures in order to help to replicate it. So the answer is false.
And there you have it, folks. Through this BVHS MythBusters segment, we hope that our community will have better information related to making decisions related to COVID and to the vaccine. For the latest information on COVID and the vaccine, please visit bvhsvaccineconnect.org. Blanchard Valley Health System, we're here for you.